Well, diabetes is an epidemic in our country, and unfortunately the epicenter of diabetes is in Mississippi, particularly the Delta. And the reason for that is we have all the risk factors that are here, what being obesity, genetics, sedentary lifestyle, good food, poor transportation, so people really can't get to the doctor's office. And unfortunately, we have the other comorbidities of hypertension, smoking, kidney issues. 1 in 8 people in Mississippi have diabetes, and as compared to 1 in 10, 1 in 11 in the country. And there are approximately 400,000 people in the state of Mississippi with diabetes, and 1/3 of all our hospital admissions in Greenwood have diabetes. So it is a big, big problem. The risk factors, genetics and obesity, and is very problematic. And in fact, the cost factor of diabetes in this country, it costs about $350 billion a year to treat diabetes. In Mississippi, approximately $3.5 billion. So it is a drain on our healthcare system, but more importantly, the quality of life. The hospital, board of directors, our CEO, Jim Jackson, and all the doctors on staff and nurses, we have targeted diabetes as a major problem that we're working coordinatedly to try to get everybody under control, and so you don't end up in that bad loss of limb situation. And again, it starts with education. Education, like anything else, is the key. And we have a diabetic education center at the hospital where you can get the information you need to A, number 1, be diagnosed, B, number 2, be treated, and to keep you under control so you can have an ordinary life. It's not a death sentence if you know you have diabetes. It's a death sentence if you don't know or don't take care of yourself. My advice to anybody, if you have the genetic predisposition, if you are obese, if you have a sedentary lifestyle, and if you have some of the symptoms of diabetes, typically one that may have high blood sugar would be one that is always thirsty, one that is always going to the bathroom frequently, rapid weight gain, fatigue, and something recently is blurry vision and vision loss, because diabetes can affect your eyes. We have a condition called diabetic retinopathy. So what we try to do is identify the risk group, get tested, and if you do have diabetes, you get your treatment early. You get your eye exam, you keep track 3 months with your medical doctor, you keep your A1C under control. By the way, that should be under 7, no cheating. And if you do a little exercise and you do what you're supposed to do, you can live a long life with diabetes. The problem is if you don't know, how can you take care? And please educate your children that they may be susceptible, and don't wait till they're 40 years old to check. If you have a risk, get checked, get treated, be on top of your game so you won't end up in a bad way.